asthma, you are not alone. An estimated 300 million people worldwide have asthma. Asthma is a chronic lung condition in which the airways become very sensitive. When the airways react strongly to triggers, they become inflamed and narrow, thus making breathing difficult. Your first step is understanding asthma to manage it well. Once your asthma is under control, you should be able to do your normal activities like having a good night's sleep, traveling, or playing a sport. Children are more likely to have asthma than adults, but they can sometimes outgrow it. Asthma can also start for the first time in adults and can be a lasting problem. Let us understand what happens when you have asthma. When you breathe, air travels through your nose and mouth into your lungs. It travels through the airways that branch into smaller and smaller branches like a tree. In people with asthma, the airways tighten and narrow during an attack, making it hard for air to get in and get out of the lungs. Also, the lining of the airways get irritated and makes plenty of mucus, which further blocks the flow of air. Symptoms of asthma includes difficulty in breathing, tightness in chest, whistling or wheezing sound, and coughing. Your doctor will diagnose asthma based on lung function tests, your medical history, and a physical exam. Your doctor may also use a device called a spirometer to check how well your lungs are working. When your asthma symptoms become worse than usual, it is called an asthma attack. Severe asthma attacks may require emergency care. There is no often obvious reasons that causes asthma attacks. However, some people find that symptoms are triggered or made worse in certain situations. You can control your asthma by staying away from things that trigger an attack. Some of the most common triggers are tobacco smoke, dust mites, outdoor air pollution, cockroach allergen, pets, mold, pollen, and smoke from burning wood or grass. Asthma symptoms can be prevented, most of the time with treatment. So you are able to lead a normal life with school, work, sport, etc. Treatment usually involves learning to recognize your triggers, taking steps to avoid them, and taking medication in the right manner. Your doctor will evaluate you on a regular basis to see how well your treatment is working. It's very important to stick to your treatment plan, even when you feel very well. Asthma is treated with two types of medicines: long-term control and quick relief medicines. Long-term control medicines help reduce airway inflammation and prevent asthma symptoms. They include inhaled corticosteroids, leukotriene modifiers, and long-acting beta agonists. You cannot become addicted to inhaled steroids even if you use them for many years. Quick relief or rescue medicines relieve asthma symptoms that may flare up, and they include short-acting beta agonists. Carry a quick relief inhaler with you at all times to stop asthma symptoms. It is vital that you use your inhaler correctly. In some people, symptoms persist simply because they do not use their inhaler properly, and the medicine from the inhaler does not get into the airways properly. If you're using inhaled corticosteroids, rinse your mouth well with water, but don't swallow. Important part of a healthy lifestyle is good nutrition. Few simple steps can help you manage your asthma in a better way, like eating small but frequent meals, relaxing during mealtime, including fruits and vegetables like guava, bell pepper, broccoli, cauliflower, and foods rich in omega-3 fatty acids like oily fish, flaxseed, etc. in your diet. Known food allergens which can aggravate asthma in some people are peanuts, shellfish, wine, pickles, etc. Asthma can be challenging and stressful. The best way to overcome anxiety and a feeling of helplessness is to understand your condition and take control of your treatment. By taking an active role in the management of your asthma and by partnering with your doctor, you can lessen the chances of asthma attacks, breathe easier, and live a healthier life.